If you are a new medical provider or mental health provider, you're probably aware there is an increasing risk of suicide attempts and suicide admissions to the ER recently, especially for younger kids and teenagers. There are a couple of standardized ways we can try to be very thorough and proactive about assessing for suicide to help address this crisis happening in the United States. So number one is standardized suicide-specific screeners. So not just screeners for depression, like you're not depressed, are you? But actual screeners like the Columbia Suicide Screener, starting from the age of 12 is a general recommendation, but if you have concerns at a younger age, it is appropriate to ask. In our hospital, we start from the age of 11 consistently, but again, if we get any weird feelings or vibes during a patient encounter, it is appropriate to ask in an age-appropriate way if they thought about hurting themselves, if they thought about ending their own lives, things like that. We also want to use non-judgmental language, so things like died by suicide rather than committed suicide. We also want to assess for all of the other determinants of health that might be contributing or could be a risk factor. So things like substance use, trauma, being from a specific minority population. We know that there are not equal rates of suicide attempts across our different populations in the United States for obvious reasons. And we always want to talk about access to lethal means. I work in Texas, so this is a more common problem here, but ensuring that families have gun safes and are safely storing their weapons according to all the proper protocols and guidelines, because that is the number one best predictor of preventing suicide is just lack of access to lethal means. And of course, refer to your psychology and social work colleagues in the hospital setting.